Hi, my name is Karen. I'll be your nursing student today. Can I get your name and date of birth?
Catherine Webster, 41501.
Okay, so today I'll be performing a head, face, neck, and regional lymphatic assessment. If that's okay, we're gonna go ahead and get started. Do you have any questions for me?
Nope.
All right, I'm gonna have you confirm your age for me.
21.
All right, your weight,
130.
your height.
4'11" and a half.
All right, and then I see some visible tattoos and some visible piercings. I see overall skin, fair skin all over the face and neck. And then, how's your gait?
It's good.
Okay, so I notice good personal hygiene, no odors. We're just gonna get a quick history. So do you have any history of head injuries?
Mm-mm.
Of neck or cranial surgeries?
Nope.
Any dizziness?
Nope.
Any neck pain?
Nope.
Any headaches?
Nope.
All right, history of chronic illness?
Type 1 diabetes.
Any medications?
Novolog, Wellbutrin, Ozempic, and naproxen.
All right, and any allergies?
Just a hairspray.
All right, and then do you have any concerns at the moment?
Mm-mm.
All right, so I'm gonna have you sit at the edge of the bed for me. So I'm just going to be inspecting your face. So what I'm looking for is symmetry of the eyes, which I see, symmetry of the eyebrows, symmetry of the mouth and the folds. Everything looks good. Next, I see that your facial expression is neutral. I don't see any drooping, which is indicative of Bell's palsy. And then any abnormalities. No, I don't see any swelling, any ridges or bumps. And then I don't see any visible pulsation in the temporal area. For your head, I see that it's within the midline. The shape is proportional to your body. And then I don't see any involuntary tics or movements. For your neck, I don't see any red streaks, any swelling that can be indicative of lymphatics. I don't see the pulsations of the carotids either. All right, I'm gonna have you do some range of motion. So can you move your head from left to right real quick? Can you move your head up and down? Did you feel any pain during that?
Mm-mm.
I didn't see any limited range of motion. And then I see that your trachea is within the midline. Can you do a quick swallow? And then I saw movement of the hyoid bone. Okay, so we're just gonna be doing some cranial nerve assessments, starting with your facial nerve, which is cranial nerve 7. So I'm gonna have you smile. Can you frown? Can you raise your eyebrow? Okay. So I'm gonna be touching my hands to your face, if that's okay. All right, I'm gonna have you close your eyes and keep them closed while I pull. Good, you can open them. All right, I'm gonna have you puff up your cheeks. Keep it puffed up. I'm gonna put my hands on your cheeks. Good, and let go. All right, I'm gonna have you tighten your lips. Keep them like that while I pull. Good. And then can you whistle for me?
I'm not a whistler.
That's okay. Do you experience any excessive saliva or tear production?
No.
Perfect. Do you have any hearing problems?
Mm-mm.
All right. So now we're just going to be testing your trigeminal nerve, which is the cranial nerve 5. So can you clench your teeth? Okay. And then movement of the mouth from side to side. Perfect. All right. And then that's good indication of your mandible muscles. All looks good. I'm going to palpate your temporal area. So hand to the face again. I feel your skin is warm. Good. Thank you. All right. Now I'm going to be palpating your temporomandibular joint. So you let me know if you feel any pain or limited range of motion. So I'm gonna put my hand right here. Go ahead and open your mouth for me. Okay. I didn't hear any popping or crackling sound, which can be indicative of Cryptitis. Did you feel any pain? Perfect. All right, so now I'm going to be palpating your head. Do you mind letting your hair out? So I'm going to be looking for any lesions, any tenderness. I want to see smooth. So palpating. Okay. Everything looks normal. I'm going to be assessing your lymph nodes now. I'm going to start the one at the base of the skull, which is your occipital. Okay, I'm gonna move to your post-auricular, sorry. And I'm noticing everything is smooth, no tenderness, nothing's movable. This is your preauricular, submental, submandibular, right here. Okay. And then your posterior cervical chain. Do you feel any pain as I'm palpating?
Nope.
And then your supraclavicular. Okay. Everything looks normal. I didn't feel any tenderness. The consistency was normal throughout all of those lymph nodes. All right. Now we're going to be assessing your cranial nerve 11. So can you shrug your shoulders for me? All right. Now I'm going to place my hands on your shoulders. Now you're just going to do the same thing, but with resistance. So I'm going to be pushing down and you do the same thing. Perfect. All right. Now you're going to be turning to your right. So against the movement. Yep. And then good. So those are normal. I'm going to palpate your thyroid. So we're just gonna look for the, okay. I'm gonna do the anterior approach. I'm gonna have you hold this because we'll need it here in a little bit. All right, so take a sip and then hold it. All right, so I'm gonna be finding that thyroid gland again. Go ahead and swallow. Okay. All right. Did you have any difficulty swallowing that? All right. So that was normal. I don't see any signs of dysarthria, which is difficulty with language. Okay, so now I'm just gonna have you open your mouth and say ah.
Ah.
All right, I would have a pen light with me, but I do not have one with me, but I could still see the uvula in the midline, which is good. Overall, I did not see any abnormalities, none with the lymph nodes, none with the cranial nerves, and inspection and palpation of everything else was normal. Do you have any questions for me?
No.
All right, thank you.